Basic implementation of observations clinical observations, aspirin exacerbated respiratory disease. The clinical implication of basic research series has focused on highlighting laboratory research that could lead to advance in clinical therapeutics. Background: Aspirin exacerbated respiratory disease is characterized by asthma, chronic rhinosinusitis with nasal polyposis, and photonomic respiratory reaction to aspirin. It had been estimated that this syndrome affects 7, 7% of adults with asthma and 14% of those who have severe asthma. Pathological aspirin exacerbated respiratory disease is characterized by marked eosinophilic inflammation and ongoing mast cell activation in the respiratory mucosa. Pathologies: pathological A- AERD is characterized by marked eosinophilic inflammation and ongoing mast cell activation in the respiratory mucosa. The frequent, the frequent recurrence of nasal polyps after surgery, as well as the requirement for high-dose glucocorticoids to manage the asthma, reflect the aggressive, persistent nature of the disease. All non-steroidal all non-steroidal anti-inflammatory drugs that inhibit both cyclooxygenase COX-1 and COX-2 may provoke the pathognomonic reaction. These reactions are accompanied by idosyneratic activation of respiratory tract mast cells. In contrast, patients with AERD can usually be treated with COX-2 selective drugs without having these reactions. Questions: what accounts for the dependence on COX-1 for the maintenance of homeostasis over cysteine leukotrienes synthesis and mast cells activation in AERD? Several lines of evidence suggest that prostaglandin E2, a ubiquitous COX pathway product, maintains a critical check against 5-lipogenase activity, and mast cells activation. PGE2 synthesis characteristically increased with inflammation as a result of upregulated expression of COX2 and microsomal PGE2 synthase in several cell types. If PGE2 is critical to homeostasis, what accounts for the idosyneratic activation of mast cells and the severe recalcitrant eosinophilic inflammation of AERD? Interleukin 33 and systemic stromal lymphoprotein are cytokines, derived from structural cells that provide a first response to environmental proteins, hormones, and viruses. Questions: one such mediator, PGD2, is generated at particularly high levels in persons with AERD at baseline and specifically during reactions. PGD2 is a potent chemotatic factor and activating ligand for eosinophils, basophils, and lymphocyte helper cells, activating chemoattractant receptor homolog expressed by type 2 helper T cells, and it elicits bronchoconstriction through T prostaglandin receptors.